Hello you guys, welcome back to my channel. Thank you so much for tuning in. If you're new here, this is Simple Nutrition, giving solutions to everyday nutrition problems. And today we are going to talk about the causes of hypoglycemia and the causes of hyperglycemia. So if you're not a fan of watching videos, I want to remind us that we do have a blog. I'm going to put the link to that website down on the description box below so that you can click and follow and read those blogs. The same videos we post on here on YouTube are the same topics that we discuss on the blog. So like the topic suggests, you're talking about diabetes. Diabetes mellitus is just a group of diseases that are characterized by hyperglycemia, elevated blood glucose levels. But we in patients with diabetes mellitus, we also have hypoglycemia when the sugars go way low than they should. And as much as hyperglycemia is bad, hypoglycemia is very bad because it can lead to loss of life very fast. So we already know the types of diabetes. We've discussed that in a previous video, but we do have type 1 diabetes, which is common in children, which is an autoimmune disease. There's complete insulin deficiency. That means the patient who has type 1 diabetes has to be on insulin therapy. We also have type 2 diabetes, which the main cause of it is lifestyle changes, a lack of exercise, being obese, being overweight. So that is just in a nutshell. And the signs and symptoms of diabetes would be, the three main common symptoms would be, frequent urination, the need to go to the washroom all time and again. We also have frequent thirst. We also have, frequent hunger, that is polydipsia, polyphagia, and polyuria. Those are the three most common symptoms of diabetes. But we also have, unwanted or unintentional weight loss, especially for patients with type 1 diabetes. They may have unintended weight loss, bedwetting, especially for children. That would be a sign of type of diabetes. But on today's video, we want to focus more on the causes of hypoglycemia, so that we can prevent emergencies. We can prevent the need to rush the hospital to find solutions. So hypoglycemia is when the blood glucose levels go too low, and the signs and symptoms of hypoglycemia is loss of consciousness. Most people would faint, loss of concentration, feeling tired, less of energy. That would indicate hypoglycemia. And hypoglycemia occurs mostly in patients who have diabetes, mostly because they take medication without eating. Diabetes, the drugs for diabetes are taken just before food. So when you take the medication and you don't eat, that means the sugar in your system is going to go low. That is the most common cause of hypoglycemia in people living with diabetes, taking medications and not eating. Another thing is exercising too much. There's a video I did on diabetes myths, the myths that surround diabetes, and we talked about exercising. When you're in a sports activity as a diabetic individual, you need to work very closely with your doctor, so that you can be able to monitor your sugars very closely. Too much exercising, what does exercising do to your body? It leads to burning of the calories. The sugars are going down and down. When you're diabetic and you're engaging in too much of exercises, there's a very huge risk of getting into hypoglycemia. We're not saying that you shouldn't engage in sports activities, but you should work closely with someone who can be able to monitor your blood glucose very well. Another common thing that can lead to hypoglycemia is using your insulin in the wrong way, using too much of it. The work of insulin is a hormone produced by the pancreas. The work of insulin is to help get the sugar from the bloodstream into your cells and muscles so that you can get energy to do your day and day activities. So for a patient with diabetes, we already say there's either insulin deficiency, complete insulin deficiency, or there is insulin resistance. The body is producing the insulin, but the cells are resistant to it. There are so many causes. Anything that's around insulin. When you're on insulin therapy and you're overusing it, that means the sugar in your system is going to go. It's going to take all the sugar in your system, and then you go into hypoglycemia, you start to faint, you start to lose consciousness. So another thing is your diet is very low in carbohydrates. I did a video on is a low carbohydrate diet good for patients with diabetes, and the answer is yes. Only with healthy sources of complex carbohydrates, healthy sources of proteins, healthy sources of fats. You don't want to go into completely no carbohydrates, because when you do that, then that means there is no glucose in your body at all. The body can still burn the proteins and the fats for energy. That's something, but the body also needs glucose. For the patient with diabetes, we are encouraged a low carbohydrate diet, but not restricting carbohydrates completely, because restricting carbohydrates completely is also one of the causes of hypoglycemia. You'll go into hypoglycemia, their sugars will go down. So that is also another cause of hypoglycemia. Common or less common, I don't know, but alcohol consumption. Alcohol consumptions lead to hypoglycemia. And for patients who are living with diabetes, we encourage you to find ways to moderate your alcohol intake or stop alcohol intake completely. And lastly is mixing medications. When you're in insulin therapy, you're also taking oral medications, you're taking too much medications for the same type of condition, then what is going to happen is that all these drugs are working to lower your sugars. And when you're mixing them without knowledge, then you may end up getting to zero. You might end up risking your life through hypoglycemia. So you discover that the causes of hypoglycemia rotate around medication in your food. That is why we did a whole video on what should a diabetic individual eat, what is recommended for a diabetic individual. And knowing when to eat, when to take your medications is going to help you a big deal in preventing hypoglycemia. Hypoglycemia is very, very bad, like I've already said. As much as hyperglycemia is bad, but hypoglycemia is very bad. So when you get into hypoglycemia, what is going to happen is that then if the patient is awake, you can be able to give two sugary snacks, like soda, like something sugar, like a banana, like glucose, just something to raise the blood glucose very fast. But if the patient is unconscious, what are you going to do? You're going to go the IV way, just to make sure the sugars go back up and the patient is and the patient gets to stable. And if the patient is stable, then you encourage the patient to eat. Now, we have discussed about hypoglycemia, but what about hyperglycemia? Hyperglycemia is very common, and that is what describes diabetes mellitus, that the group of diseases characterized by elevated blood glucose levels. Now, hyperglycemia, signs of hyperglycemia are not the same as hypoglycemia, because in a hyperglycemic patient, you realize confusion, you realize lack of concentration, irritability, sweating, a lot of sweating, and sometimes even getting into an unconscious state. What causes hyperglycemia? Hyperglycemia also rotates around the food and medication. When you don't take your medication and you are diabetic, hyperglycemia will kick in. When you eat too much foods that have too much sugar, like the processed carbohydrates, then hyperglycemia will kick in. When you eat too many times in a day, hyperglycemia may kick in. So in short, what are we talking about here? To prevent hyperglycemia, it's just to maintain your normal meal times, maintain your normal times of medication. 3 meals in a day and healthy snacks in between should help you prevent unhealthy snacking. Balance that. We have talked about the portion control using the plate model, the hand size guide. Portion control and taking your medications as recommended should help you prevent hyperglycemia. Leave your questions on the comment section below. Let me know if you have questions about hyperglycemia or hypoglycemia. Let us have a communication, let us have an engagement, so that we can get solutions to these problems surrounding us. So again, we do have a blog. The link on for that blog is down in the description box below. Go and follow that blog, read the blogs. The same videos here are the same topics we discuss on the blog. So thank you so much for joining us today. Until next time.